Hi, I'm Dr. Kevin McCurry from Whitney Plaza Dental in Sheridan, Wyoming. Welcome to episode 4 of NTK, Need to Know. Thank you for joining me. In the last episode, we talked about the dental myths that cause people to give up. Now I want to talk about hope and why it still matters, even if you've been told it's too late. My father lost all his teeth before age of 41 from what was then called pyorrhea, advanced periodontal disease. He also had a 4-way heart bypass at age 41 and passed away the day before his 50th birthday. He smoked 2 packs a day, and his diet was poor, and his oral hygiene was uncertain. Chronic inflammation was quietly damaging his gums, his blood vessels, and ultimately his heart. Before he died, he encouraged me to become a dentist. I believe it was because of the suffering he endured, and in doing that, he changed the course of my life and the lives of the patients I care for today. Here's the powerful part. I share his genetics, and yet I've never had gum disease, and I haven't had a cavity in 51 years. My wife and I raised 6 children without a single cavity. Same genes, completely different environment. Periodontal disease is not genetic. It's a chronic inflammatory disease. We now know it's strongly linked to heart disease, stroke, diabetes, Alzheimer's, and pregnancy complications. The bacteria in the infected gums can enter the bloodstream and trigger inflammation throughout the body. Your mouth is the gateway to your body. But for a long time, medicine didn't treat it that way. Today, we clearly understand that connection. Dentistry today is very different than it was 50 years ago, just like cars. Better technology, better materials, better diagnostics, better outcomes. We now understand bacterial biofilms, saliva chemistry, bite forces, airway, and sleep breathing, jaw position, muscle balance, and how inflammation affects the whole body. We are no longer just fixing teeth. We are restoring function, comfort, health, and confidence. We can stop gum disease. We can stabilize worn and broken teeth. We can replace missing teeth. We can improve sleep and breathing. Even people that were told they were hopeless often are not. I'll leave you with one more true story. A patient came to us after 2 offices recommended full mouth extractions and dentures. I extracted nothing. We found a stable, comfortable jaw position. We stabilized it with orthodontics. We placed crowns and a couple of implants in the upper arch, and I did nothing to the lower arch except braces. That was 7 years ago, and they still have all their teeth. If all you have is a hammer, everything looks like a nail. That is why training and experience matters. It gives one more tools. I became a dentist not just to fix teeth, but to prevent people from suffering the way my father did. Back then, neither he nor we had the knowledge or the tools that we have today. You are not doomed to follow your parents' footsteps. Be hopeful. Your past does not have to be your future. Next time, a silent destroyer. If you'd like to learn more, visit whitneyplazadental.org. Thanks for watching.